In our many interviews which formed part of our research for this new edition of Every Doctor, our colleagues commonly told us they did not wish to revisit the COVID-19 pandemic or read about it. We fully understand this sentiment, but we need to confront what we have learnt from it up front in Chapter 1. This allows us to fully acknowledge the distressing impact of the pandemic on all of our lives, and only then can we move on from this context constructively without the cloud of the coronavirus dominating other chapters. Everyone just wants to move on. Don't dwell on the pandemic in your book. Maybe a common response, but is it a healthy one? We acknowledge that for many clinicians, particularly early career doctors, the pandemic is defined by loss. Loss of career progression, exam preparedness, and training opportunities. Loss of certainty about the future, growth in friendships and relationships, and formative social and emotional experiences. Loss of patients, colleagues, and resources in unprecedented volumes. Many of us are grieving for the loss of family members, friends, and colleagues across the globe, and facing a long, uncertain future of hardship. Thinking about the COVID-19 pandemic and grieving these losses is not straightforward. Chapter 1 may therefore trigger painful memories, particularly in doctors continuing to serve patients and communities where the consequences of the pandemic are omnipresent. When there is a lack of support for recurrent trauma, avoidance can be a survival tactic. However, while avoidance of thinking about negative or traumatic events through overwork or superficial distractions outside work can provide temporary relief from unpleasant memories, it does not stop recurrent intrusive thoughts and rumination when we are vulnerable or triggered. Specifically, we may be surviving from day to day or presenting a stiff upper lip, but we are far from feeling content in life and work. If this is the case, it is entirely understandable if our listeners prefer to defer listening to Chapter 1 until after they fully work through their losses, grief, and trauma with family, friends, colleagues, or treating professionals. This can take time. Before we face the realities of the pandemic in Chapter 1, we wish to acknowledge the enormous contribution of doctors in treating patients with COVID-19 and non-COVID-19 conditions. Doctors showed up under impossible circumstances in acute hospitals, aged care facilities, general/family practice and other specialist consulting rooms, and community and mental health settings in metropolitan, regional, and remote centres.